Hi, everyone. It's Adrienne with Good Dental Media, and I'm joined today by Dr. Scott Schwartz, who is a New York-based orthodontist, and he is the founder of InSmile Braces. He's a Columbia-trained specialist and one of the top providers of lingual orthodontics. He led the relaunch of the technology after InBrace shut down by acquiring the IP, improving the system, and bringing it back to market with a mission to prove its clinical effectiveness. This is exactly why we're here today, because I got to have a conversation with Dr. Schwartz about this exact thing, taking over the IP for InBrace. I know most of us in the orthodontic industry remember InBrace, and there's a lot of things to discuss here, and I think the conversation is worth having. It's a great story, and so I wanted to just interview and chat with you for just a few minutes and see if we can clear the air and talk about some amazing things that you're working on. So thanks for joining me.
Thank you, Adrian, for having me.
Yeah, so I mean, for anyone that might not be aware, which I think everyone is, but if anybody's not aware of, the history of lingual braces in orthodontics in the past, I don't know, maybe 5 years, 5 to 10 years, and how it's evolved, especially over the past couple years. Maybe you can shed a little bit of light on that and give some background on how you've became a top provider in lingual braces.
Sure. So, in my practice, probably about 8 or 9 years ago, a lot of patients were coming in that wanted a more aesthetic choice than aligners. They weren't complying with that. And I really basically looked around, and Incognito at the time, which has now sunsetted in April of last year.
It's news.
Basically, I did a couple of years of that, and I found it to be great, a great product, but it wasn't as simplified as InSmile Braces. So I think a lot of doctors, when they think about lingual, they say, oh, that's way too hard to do, the technique, it's so technique sensitive. And I agree that many of the systems out there are very technique sensitive. And that's why when about 2 years after I started using Incognito, I was one of the early adopters of InBrace at the time.
Mhm.
And that was a product that made it much, much easier to treat lingually because a lot of the movements were already built into the wire, which allowed the doctor not to need to do bends and all these things, thinking upside down and backwards, and they don't have to do that. So with this technology that InBrace evolved with, was all the movements are built into the wire, and that's the key. And I think that's something that has simplified it over and over again for me many times. I've treated about 1,000 patients in my practice with this technology, and it's growing every day in my practice. It's really been an unbelievable journey for me, and it's grown my practice exponentially for me at least.
So take me down that path of how it came about on you acquiring the IP and relaunching the system. Like what led to that decision?
So originally, since I was an early adopter, I had worked with the engineers and the production people early on and the internal company. And so I knew how things were going there, which was, obviously uh, an interesting journey in itself because a lot of things that they did, I helped to create. I invented the smart wire plier for them and helped design new wires, and they were very appreciative of that, and it was great working with them for sure. And so when on April 22nd, when we got the email that the company is shutting down and that's it, I had calls from many providers, such that I'm friendly with, and said, "How could we let this go?" And I'm like, "I don't know. I mean, I just said, like, what am I going to do? Just buy it?" And they were like, "Yeah, you're the guy to do it because you're the one who's been involved with the company so much." And so I started thinking, "Hey, maybe that's a good idea." And I started chatting with the engineers. We had multiple meetings trying to figure out how we could run this company in a much leaner company, as far as expenses and get the product out to providers in a timely fashion like the previous company was doing. And so after hours and hours of meetings, we came up with a new business model that actually can do it, and we can become sustainable with in a short runway here, maybe within 12 to 18 months, let's say, and which is unheard of for a startup.
Right. Well, I mean, there were actual patients at the time that were in the middle of their treatment. So I could
Right.
imagine the urgency there. Your own patients
Absolutely.
and others, right?
Right. So, I knowing the product, how it works, basically the wire does most of the work for me. So I basically said, all right, let me see if that'll work. And in the meantime, let the wire just work its magic like it normally does. And wherever they finish, if I can't make this transaction happen, I'll just get the most out of the product for each patient. And then I'll finish them up with whatever treatment modality they would need, depending on how much more treatment they required. And so, basically, after about a month and a half, I was really into this. And I said, okay, this could really, really happen. And I was super excited. There were so many people talking to me at the same time saying, we're excited. And what's fantastic is once I did bring it on, we had over 200 providers just sign right back up in the first 3 weeks of me launching in August of 2025.
That's amazing. And you
Yeah.
you did make some improvements, correct, to make it
Yes.
even a little bit more streamlined.
Yes, and we're working on that every day. The advantage is I'm a provider myself. So every time I'm working on a patient, I'm always thinking of how we could make this easier for the clinician and easier for the staff to implement in their practice. And right now, we're launching a few new things about the wire, which would make it easier and less wires needed to complete the case, which has always been where you needed multiple wires, and we're trying to minimize that for most doctors. And ideally, what I'd like is to actually be able to ship all the wires needed to complete the case without needing what we call refinement or additional wire in the future. That would be something that would be amazing, that you could have everything, all you need to complete the case already in your office from day one.
So, there's still some skepticism in the orthodontic community, I'm assuming, around lingual systems and what's been out there. So what would you say to doctors who are unsure whether this really works compared to other options?
So I can only speak about myself and the 1,000 patients that I've treated with it, and the amount of feedback that my patients, every time they walk in and they're saying, I can't believe how much my teeth moved. And the
Hmm.
fact that on average, I'm finishing my cases in about a year, which is great. And maybe seeing them, for me at least, seeing them at least half, maybe I would say 60% less than I would normally see a labial case going. And again, it's letting the wire go and that's the magic of our product, is the wire, letting it work as long as possible. These wires could work 3 to 6 months. And I'll tell you a little story. I learned that the best actually when COVID happened, when I wasn't able to see the patients and I wouldn't be seeing patients for months at a time. Once we started getting back into the office and I started seeing these patients come in the office, I realized how much these wires had straightened out their teeth by me not doing anything and just letting the wire work. So that's when I realized, like, this is a product that cannot just disappear for us. This is something I truly believe could change the way a lot of treatment could be done for adults who want a truly aesthetic choice. Right now, in my office, actually, the high schoolers are the biggest growing population for me because they don't want to see braces, and the parents don't trust them to be compliant with something that they would have to take in and out of their mouth all the time,
Right. I was just going to say the compliance with Invisalign, then you don't have to worry about,
right?
right?
There's zero compliance here, and you could floss. We have a specialized wire. It's really pretty amazing. That's the only reason that I knew it, that I can't just let this just disappear.
Well, I love that. I can sense the passion that you have for this product and for this industry and for your patients. And that's why I wanted to chat with you. And I think that there's a lot of thought behind what you're doing with this product. And I think the industry, should really come to um come to check it out themselves. I understand that you're going to be at AAO and that you have a booth.
Absolutely.
Do you know your booth number off the top?
867.
867. So booth 867. AAO is coming up. If you're watching this after the fact, I'll post a link to their website. I'm sure there's ways that doctors can reach out. We'd love to get feedback. I'm sure you would love to get as much feedback as possible. Um, I think that, there's a story to be told here, and I'm happy to work with you to get the story out, and hopefully more doctors will learn about this product in particular and how it helps patients and how much your patients are loving it, and what it's really doing for them. Because at the end of the day, that's what really matters. Um,
Yes.
and I can again, I sense your passion with this, and also, maybe you could speak to just in closing here in terms of sticking around and what your goals are. I know that we chatted a little bit on offline about how you'd like to expand and um, you know this isn't like a fly by night situation. Like this is sticking around. So if you
Absolutely.
like to speak to that, go for it.
Yes. So basically, I'd like to see our company obviously growing here in the US. We have a lot of the providers, the new providers that are out there, then the startups reaching out to us. We've gotten a lot of new providers signing up, which has been fantastic, and really not much marketing to begin with. We're only 7 months, 8 months out of the gate here. And I'm launching a new product in there, which is basically, we call it the 4 to 4 product, which is really addressing the social sixes, which a lot of patients come in to the office looking just to straighten out their front teeth, and this is a
Hmm.
great product for them. We are basically having a lot of new changes. We're simplifying all the instructions. We're giving like a step-by-step instructions to providers. We're doing training. We have these new training kits for all the new providers. And we're here to support the provider. My goal is to make you super successful. I'm the one, myself and Dr. Lee, we're chatting with orthodontists, giving them tips and pearls as we go along. We are really a provider-based company. We want to make you successful. We don't want you to just try it and then not let us know how it's going. We're interested. We want to know what's going on. We want to support you. We want to make it successful. And I know that in the office, this is something that is needed, an aesthetic choice like this with no compliance. And it doesn't have to be your main portion of your practice, but it's something that you will find that more and more people, once they realize they can do that, they could do treatment with behind their teeth, they would choose that as an option in your office. And
Right.
that's what I've been finding. Matter of fact, I show it in my consultations, and I even get some of the parents to just become patients right there because they didn't even really realize it. They're like, wow, you can do that? I always wanted to straighten out my bottom front teeth, or this front tooth bothered me. Yes, in the chair, I'll take a quick peek. I couldn't believe how many of the parents that I've gotten as patients in the office. So I know we're here to stay. And I know that once the provider's out there, see that the potential for it in their office and actually how good the product works, they'll use it more and more in their office. And we're going to try in 2027, we're going to be reaching out internationally as well. So that's something that was never done with the previous company. And we have a lot of distributors out there that are looking to work with us. So we're here to stay, and we're going to make it easier and easier for you to use this in your office, and having you part of it through this journey to help me make this company what I feel it should be in the orthodontic field would greatly be appreciated so much.
I love it. Love it. Definitely anyone watching, reach out to Dr. Schwartz. I'm sure he'd love your feedback. Drop some comments, some questions below. We can tag Dr. Schwartz. So let's get the conversation going. I think this is a great topic, and it's the best timing. AAO is one of the biggest events in orthodontics, and I'm excited for you to be at the show. And again, if you see this before or during the show, stop by and say hello and check out the system for yourself. And thank you so much for taking the time to chat with me.
Thank you, Adrian. I
Thank
appreciate it.
you. Take care.